everyone. Faith here. I am extra special about our guest today because you get kind of a sneak peek into an actual bellicon team member. So I'd like to introduce Jonas. Jonas, just a brief background, is based with our Cologne, Germany team. He has a bachelor's in physiotherapy, which I think is always amazing that I want the world to know we actually have physiotherapists like on staff thinking about our workouts and thinking about our products. Master's in prevention and health management and 6 years with bellicon. So Jonas, thank you for
Yeah,
joining.
thank you for the invitation that I can join you today.
Yeah, it's just extra special because I always am blown away. Like we do sort of internal company talks, and whenever Jonas presents, it's like super interesting, super knowledgeable. So I want you all to hear it. So we'll kick off. Our topic today is osteoporosis. So my first question for you, and if you want to add anything to your intro before the question, please feel free,
Yeah,
is what is osteoporosis? But please give us your intro first.
yeah. Thank you again, Faith, for the invitation. Today I will give you an introduction about osteoporosis. I want to keep it simple because I think everybody has heard about this topic, and for us, it's the most important thing to know why is bellicon training. An option and a good option if you have the diagnosis osteoporosis. But in general, osteoporosis is a condition where bones become weak and brittle. And that happens when the body loses too much bone, or on the other hand, it makes too little bone mass. That can both happen, and that can be the reason why osteoporosis is occurring. And as a result, bones can break easily, and even, for example, from a minor fall or a bump. So most common areas that are affected are the joints like the hips, the spine, and for example, the wrists. And it's often called a silent disease. And I think that's interesting because most of the times, you don't even know when you have a first grade of osteoporosis. It's silent until you visit a doctor. He does a bone mass test, and then there's the shocking diagnosis, osteoporosis. You never heard about it, you never thought about it, you might even have no symptoms at all. Yeah, but there's the diagnosis, and of course, a lot of patients want to know what can I do now. We will come back to this later, I think.
Yeah. So what are some of the risk factors if it is silent? What
Yeah.
how would you know to even get tested? Like or
Yeah.
that you get tested?
Yeah, risk factors include aging, and for example, also low
All
calcium.
guilty of that.
Well, that's basically one of the biggest risk factors because the hormonal changes come with aging. So especially for women after the menopause, there are hormonal changes happening, and that increases the risk for bone mass loss, and also low calcium levels or low vitamin D levels. So mostly, if you do a routine check at your doctor at a certain age, they will also test you for osteopenia, which is first grade of osteoporosis, or for osteoporosis later on. So in Germany, that's a normal checkup when you are getting older. I guess it's also how it's treated in the US. But the good news is that with a healthy diet and regular training, staying active, you can prevent or manage osteoporosis.
Okay, so we'll focus on the good news now. So let's talk about the good news, which is
We should do that, yeah.
good news is you can prevent this, and that's amazing because we can't prevent everything. So that's brilliant. So how should we train on the bellicon? So let's actually start with why bellicon? Why is bellicon training? Why is rebounding on the bellicon beneficial for osteoporosis?
One of the best things that you can do when you get the diagnosis osteoporosis is keep on moving, or even increase your activity level and do more training, more physical exercise. That's in general. And what's recommended is training that's on the one hand friendly for your joints, that improves your balance and strengthens your muscles, but in a gentle way. And that's exactly what the bellicon is for. So that's why it's such a perfect fit for osteoporosis training, especially because we have always, if you are training on the bellicon, there's balance training included. We have the surface that's not stable. So even if you're standing on the bellicon, that's level one of a balance training, I would say. And yeah, if you get more, if you do more complex movements, that's also always a training for your balance as well. And that's why it's well suited for osteoporosis training.
Perfect. So one of the questions we get a lot when people call in, at least in the US market for sure, is do I need to talk to my doctor before I start? Because a lot of doctors don't know what rebounding is yet. It's still, at least in the US, it's still just not, there's sort of a lack of education in that area. So
Yeah.
what's the answer to that? Well, how do we, what advice would you have?
Yeah, I mean, it's good if you talk to your doctor about this first, because yeah, it just removes fear, and yeah, most of the times, if you don't have like a very severe grade of osteoporosis, but severe grade of osteoporosis means that you had fractures before, and
Okay.
even fractures that came like very spontaneous. So you didn't have like a heavy fall, um, but you go to the doctor because you have, for example, pain on a specific joint, and then they tell you, oh, yeah, that's a microfracture of your bone. And a lot of patients are surprised by that because they don't remember a specific movement or a fall which caused that injury. So that would be a severe grade of osteoporosis, and I would always recommend to talk to a doctor if you have that grade of osteoporosis. But let's say 95% of osteoporosis patients get the diagnosis pretty early, and then it's very clear that you have to stay active, and every doctor will advise you to work out, to exercises, to prevent and manage the development of osteoporosis. Yeah, so yeah, let's say it's good to talk to a doctor, but it's important and definitely needed if you have a severe osteoporosis. If you have osteopenia, for example, you don't have to have any doubts that you can't train or stay active anymore. That's not the case.
Amazing. And let's talk a little bit about kind of what the training is like, because I always tell people, if you're worried about falling, we have these really strong side support handbars, and the training can be very gentle with the feet on the mat. So, what should kind of be the training goals? I think sometimes when people think rebounding, they imagine like they always have to jump high. So, I want to debunk,
Yeah.
debunk common rebounding myths. Like, what would be the training goals in terms of starting if they have osteoporosis? So they've gotten their doctor to say thumbs up. Like, how often should they use bars? Keep it gentle, that kind of stuff.
Yeah, yeah, you're completely right, and that's also the reason why doctors might say hard trampoline.
Yeah.
That's not the right workout because they think about jumping, but that's basically not a movement you have to do on the bellycon because mostly you stay in contact with the mat of the trampoline. So the actual movement goes more into the mat and not that much into the air. And that also reduces the risk of falling because you don't have a high jump with a lot of risk or where it's unstable. So you're mostly in contact with the bellicon mat, or you could use the T-bar or the support handle at any time to support your balance. So there's not a huge risk of falling, to be honest. In my time at bellicon, I never had someone falling off the bellicon in an uncontrolled way that causes injuries. So um, yeah, and we build up the training. So we start with easy exercises. We focus on strength exercises, balance exercises. You can work on your posture as well, mobility training. But yeah, I would say, especially for osteoporosis, we keep it on a easier level at first, and then build up on that. And I think for me, that's also a huge benefit of the bellicon. You can start with easy movements. It doesn't have to be complex, like a high intensity workout. It's very intuitive. Just moving onto the bellicon and using the force that's created with the little swinging movements, that's already beneficial for osteoporosis. So yeah, you don't have to do like a crazy workout for a long time. That's debunked, I would say.
Good. Thank you. And how long per day? Is it important that they do something a little bit each day or for a certain period of time, or is it just about getting movement starting?
Yeah. Yeah, ideally, let's talk about the ideal way of training. It would be to train on most days of the week. So, if you can build up a routine with daily workouts, let's say 15 to 30 minutes a day, 5 times a week, that would be great. That would be a great way of prevention. But also, yeah, fewer times a week is already effective. I can give you a little, yeah, view about the research for this field
Yes.
later on, because that's interesting where we can see what's actually effective. But yeah, for training at home, I would say would be great to train most days of the week.
Okay.
But don't worry, again, just getting started is super important, and you can start with shorter sessions as well. Even 10 to 15 minutes in the beginning is already effective. And what matters is building consistency, like regular movement, and not like a 1 week, 1 day on a week you work out for 2 hours and then 6 days you do nothing. It's more about getting a routine implemented in your daily in your day.
That
Yeah.
makes sense. So let's segue. You started mentioning research. Let's segue into the research because that's always the next big question. So let's talk about you. I feel like you're king of all of the research. You know pretty much everything that's been published about rebounding. So
Yeah.
what's the evidence of just being rebounding being effective?
Yeah. Yeah, I like to stay informed about the research as well because it's super interesting for us in which direction that's developing. And to say we don't do the studies. It's basically professionals doing it, and they are not sponsored by us. So yeah, it's not we make up our own studies just to make that sure. And the study that I want to mention for osteoporosis is done on an Austrian university, so in Europe, and it's done by a researcher named Markus Posch and his colleagues. And they investigated the impact of a 12-week mini-trampoline exercise program on older women with osteopenia.
Okay.
And the program included balance training, strength training, jumping, and different exercises, all done on a trampoline twice a week. So not, as I suggested before, 5 times a week. They only did it twice a week. And the results demonstrated significant improvements in balance and functional mobility, gait performance, strength, and also reduction in fear of falling.
That's
Um, yeah,
amazing.
and that's what I told you earlier. That's super important to reduce the risk of falling because if you have osteoporosis and you fall, that will cause or that can cause a severe injury. So it's very important to reduce that risk. So for me, that's a very interesting factor in this study.
It's interesting you mentioned that because I have a client who she's in her 90s and she told me her biggest fear was falling as she aged. That was her biggest fear was falling and losing her
Yeah,
mobility. So it's a real thing. And I think when we're younger, we don't think about that because we take it for
yeah,
granted. It's just a skill that we have, and as it goes, it can really change your quality of life. So I find that to be really
that's
huge.
true. And
Yeah.
that's also a vicious circle, I would say, because if you have a risk or if you have the fear of falling, that will probably decrease the movement that you're doing in your daily life, right? If you're always like fearful and you don't know if you are safe, if your balance is working, if something's happening, you will get more inactive, and that's the worst thing for your bones because they need movement,
Yeah.
right? So
Yeah. Yes.
that's a factor for sure.
Yeah, that's huge to build that mental confidence is actually quite impactful.
Yeah,
Um, so let's thank you for the research. We will link to that in this
yeah,
that research article. And there's more research around rebounding, but that we'll highlight that one. But yeah, there's
yeah,
more stuff. So let's talk about sort of why bellicon specifically. and then how to kind of configure the bellicon for your needs if you have osteoporosis. Maybe talking a little about the bungee strength, support bars, and that sort of thing.
Yeah. Yeah, why bellicon in the first place? There's a lot of different trampolines on the market, of course. But what makes us special is the super elastic bungee cords. So those elastic bungees allows you to sink deeper into the mat and have like a smooth movement, which is completely silent as well. So your neighbors don't have to worry about weird noises. Yeah, right. Yeah, we don't have that with the bellicon. And yeah, those bungees allow you a gentle movement, gentle for the joints, and they also effectively absorbing the impact when you're jumping. So that's basically the reason why it's effective for or it's gentle for your joints, but also effective for osteoporosis because you still have the it still stimulates your bones and muscles so without jarring them or stressing them too much. Yeah, that's where we are with the bellicon.
Amazing. And what about bungee strength? Like how would you recommend? Of course, choosing. I know our website has a really great support tool to help choose the bungee strength. But if you have osteoporosis, would you recommend going a little bit firmer or staying with a softer bungee according to your needs? What would you recommend there?
Yeah, that also makes the bellicon special because we have 5 different bungee strengths, and those strengths allow us to give you the best bellicon that's suited to your body weight and to your medical conditions such as osteoporosis. And yeah, in general for osteoporosis, we like to give it slightly firmer. So it's not too soft, so your bones still get the stimulation that they need. But on the other hand, we want to have it soft enough so you have a gentle bounce there. And yeah, I recommend to check our website for that. If you are configuring your bellicon, then you can look for the right bungee strength. And there's a little checkbox where you can check osteoporosis, and then it will give you the correct bungee strength depending on your body weight, which is the most important factor for the correct bungee strength. And yeah, you can also give us a call. Our customer service team is trained on that question, so they know what's the best solution for you and what fits to your needs.
Do you recommend if you have osteoporosis just off the bat to get a T-bar or support bars?
Yes, definitely. Just we want to reduce the risk of falling, and yeah, I would always have a T-bar. T-bar can be adjusted in the height, or a support handle. You can use it on one hand, or you can even use it on the right and the left side. So yeah, that's really beneficial. Just if something's happening, and if you want to go for challenging workouts as well, it's good to have a safety backup with the T-bar. Just makes you feel more confident during your training session.
Gives you that peace of mind. That's awesome. Amazing. Thank you so much, Jonas. I also want to mention we have an osteoporosis program on our online workout platform. So if you're looking for like a place to start, we've got a program for that. And then share this if you go to your doctor and you're not sure about rebounding, share this video with them because I feel like hearing from Jonas, who's a physiotherapist, like it really makes a big difference in educating the doctors. It's funny, Jonas, I interviewed 2 physical therapists here in the States, and I said, how did you find out about rebounding? And they said, well, one of my patients told us. So it was never
Yeah,
from
awesome.
school or anything. They learned from their patients, and now they're prescribing it as a tool to heal, for all of their other patients. So I think a lot of times, if you're watching this video, you may be the person who's educating your healthcare provider. So feel free to show this to them and educate and spread the word. Thank you, Jonas. Do you have anything else you want to add? I appreciate you so much coming today.
Yeah, thank you again. I think we mentioned the most important part. And yeah, just for me, as a conclusion, maybe also because we didn't talk that much about this, I think the bellicon is a lot of fun as well. It's not only effective, it's fun. And you always need a training method that's fun and motivating because that helps you to stay on that and to build a routine. If you really think about, oh, I'm not motivated to work out, that's a huge hindrance. So yeah, for me that's also a great benefit of the bellicon. It's fun, try it out. Stay active and try to prevent osteoporosis.
I love that. Thank you so much. I agree. That's why I do it. I hate cardio.
Yeah.
Secret. I only bounce. The only thing that's kept my heart moving is the bellicon. So thank you for sharing that. I couldn't agree more. All right, Jonas, we will see you soon. And bellicon family, if you have questions, please comment. We will reply back or write us. And we're happy to support and answer them. And thank you for tuning in.
Perfect. Thank you.